I played the best 2 rounds of my life after the surgery. So I've shot two 279s and a 78.
Oh,
So
that's impressive.
I never broke 80 before surgery. So it's a huge improvement.
August is National Golf Month, a time to celebrate a sport that is loved by millions. But as enthusiasm swings high, so does the risk for injury. Stats show that 60% of golfers play through pain. The most common culprits are back and neck injuries, followed by the hand and wrist. And injuries are often caused by those repetitive asymmetrical motions of the golf swing. In your case, Cade Cooper, it became so bad you had to shelve your clubs for a while. And so we're going to talk about all that today. Thanks for joining us.
Of course. Thanks for having me on.
You're a great story. You're proof that you can go through a lot of pain and even surgery and get back on the course stronger than ever. So we're excited to talk to you. Let's start with what golf felt like before your surgery. What were you dealing with physically and how bad was your pain?
Yeah, so I mean the pain was intense. It was a lot to work through. If you can't move your shoulder, you really can't swing a club. And trying to play through it, it really altered my swing, and I changed my game around to play with the injury.
Your
Um,
injury was your left shoulder?
well, it was the pinched nerve in my neck that was affecting my left shoulder. Correct.
And so
Um,
help me with your swing. Are you right or left-handed?
I'm right-handed, so being able to bring my arm back and to make a full swing was really hard to do.
So I would
um,
imagine. How much, like, what kind of golfer are you?
so I would say before my surgery, I was shooting mid 80s. So I guess average to good, slightly
Okay.
depending on who you ask. To
I
me,
was
it's
going to
good.
say, no offense to my husband and father, but I'm going to say that's really good compared to what they do on the golf course. Have you been playing a long time? Like how long have you loved this sport?
Yeah, so I've been playing for 30 years, 20, 25 years, something like that.
What do you like about
Um,
it?
it, I like the peacefulness of it, as much as that's crazy to say. The You get out there and clear your mind, and being in the open course and talking to new people and meeting people and just kind of being by yourself at sometimes is nice. Good way to
At,
get away.
yeah, for sure. At the risk of offending all the golfers out there, like I don't know that when people think of like hardcore sports that golf is the one that first comes to mind. And yet, like as we said, that repetitive motion, I mean, you're doing it over and over. Did you carry your clubs? Did you ride in a cart? What did you do?
So I would go back and forth. I'd carry my club sometimes, and then I'd ride a cart. And as the pain got worse, I obviously started using the cart more, as it was affecting my swing even more, trying to carry 50 pounds of golf clubs on my back as well.
Oh. And what did you do? Did you go from like 18 holes down to 9 or like how did your game shrink and eventually
Yeah,
disappear?
so it actually it got worse than that. It would go and I'd play, I'd try to go play 18, and it did. It went to 9, and then it just went out. I was playing 2 or 3 holes, and then I got to where I couldn't even play up until, probably 3 months before my surgery. I couldn't even swing a club. It was just so much pain. So it got really bad there, right there at
It's
the
your
end.
main hobby?
Yeah, golf is my main hobby. That and fishing, and luckily fishing's not as strenuous.
I was saying, could you still do that?
I could still do that,
Okay,
luckily.
good. So, what was the cause of all of this?
So it's hard to actually say. I think it was something from when I was in the military. I think it was just a lingering issue that never got taken care of, and putting it off, and it slowly got worse over time. Um, yeah, it just way too much time in between and it steadily got worse and worse, and the tingling of the fingers and the numbness would come and go, and then it got to where I couldn't even feel my hand, and so it got bad.
Um, you talked about sort of, the longer things went on. What were you like? Were you putting it off, hoping it would get better, or just because surgery seemed scary and like you'd never make it back on the course? And what might finally made you say, like, all right, enough is enough. I got to do something.
So I think the reason why I put it off so long is being military. Stubbornness. I don't need this. It wasn't affecting my day to day at first. I was able to deal with it. It would go numb. My hand would go numb every now and then it would come back, and it was fine. Um, and I dealt with it for 10 years, and it never had an issue. And then it slowly kind of getting worse, but not terrible. And then I would say, the beginning of 2023, is when it started becoming more and more noticeably that something was kind of not right, but still, being stubborn, not wanting to get it done. And then I woke up one Saturday morning and rolled out of bed and I couldn't feel the left side. So that's when I knew it was an issue.
You couldn't feel anything on the left side of your body.
Correct. It completely pinched. And I think it was I think it was September, probably right around this time, August, September time frame of 2023.
Wow.
And couldn't feel the left side and had the wife take me to the hospital then. So.
Wow. Okay. So you had surgery. Just fly us through that part real quick. Was it as daunting as you thought it might be?
So I wasn't too worried about it because I was in so much pain. For my wife, it was daunting, I would say. She did a lot of research and actually, found VSI and got me in and made me go. So thankful for her. The overall experience, though,
do a wife shout out. I can't tell you how often the wives are the heroes of the heroes.
I have to shout out because she is the reason why I got done and why it got done so quickly as well. And with VSI, not just with some random person who would have cut into me at that moment because I was in so much pain.
Oh.
But after this, the whole process building up to the surgery was incredible. From the advice to what was going to take place, all of that was extraordinary. Put me at ease. And then the day of the surgery, I was in and out. And after the surgery, I felt like $1 million. I was up and walking and moving the day of the surgery.
You've
the day
gone
after
from
the
like
surgery.
not feeling the left side of your body. So coming out of surgery, maybe it was even it was better for sure than where you were, right?
Oh, I could have done backflips. It felt like, I was getting told by the wife and the nurses that I need to lay down. And I was like, I want to run around and move.
Like sit for a minute. Okay, so obviously, like the point of surgery isn't just to get back to golf, but like this is a big part of your life. So at what point in the recovery were you, able to start thinking about playing again? And did you feel nervous about that? Because that whole recovery piece of things, there's like a mindset piece and then there's a physical piece, right? So was there any mindset issue of, oh gosh, am I going to hurt it again if I do this kind of swing? Or was it just like, oh my gosh, I feel so great. Boom, here we go.
No, there was a little bit. I did have the mindset that I was going to be back quick and that I was going to, put myself through what I needed to do to get back to 100% as quick as possible. And so I told Dr. Haines that I was going to come back and that I was going to be his best patient. And I kind of stuck to that through the physical therapy and kind of in the recovery process. I ran a half marathon by myself in February, 3 months after the surgery, 2 months after the surgery, October, November, December.
And you aren't even really a marathon runner.
No, not at all.
It was just like, I feel so good. I think I could do this.
I think I could do it. And I kind of challenged myself and I challenged one of the guys that I work with to it as well. So that kind of got me in the mindset that, hey, look, I can come back. And then from there was just being able to, slowly start swinging a club in the backyard and setting my limitations so I didn't injure it, but rebuild, I guess, my momentum and my stretching and all that, and slowly came back.
All right, so we had a pretty cool moment. You and Dr. Haines reunited on the golf course recently, and you talked about life post-surgery. I want to play a clip of the conversation you had with him.
Okay.
I haven't felt any real issues since the surgery. To be honest, there's no scars.
I don't even notice that.
There is no scars at all. So it feels perfect.
Yeah, I know. It's like, talking to you, hitting with you, and also looking at him like, I don't.
No, you would never know. There's not even a little nick.
Yeah.
So yeah, I don't know what you did, what kind of glue you used.
A lot of times, and for good reason, this is a very visible area. So,
Yeah.
Scar is something that people reasonably think about. Usually, you tuck in this tiny little area and kind of put in line with the skin crease, because you don't even notice it. So. Yeah.
Well, I know whenever I was.
I can't tell at all.
No, like I said, there's nothing. When I was checking out
on the other side you're pointing to, by the way. So
it wasn't over here. I don't even know. I don't feel it, so I have no idea. The only week I try to play 9 holes every Wednesday. I try to play, and then try to get out on the weekend if I can. But if I feel like it's, you can feel your body, trust your body. It tells you if it's.
I think it's a good, listen to your body's a big thing. I tell people to do, and so it applies to where you want to be able to live your life. If you did this, of course, to get the nerve pressure off, get your strength back, it's really to live life. So I do want you to be able to do your thing. Thinking about longevity, and also it's the element that's nice. You can do stuff not have to worry. Right?
Dr. Haines mentions there the importance of getting back to doing what you love. So when you were talking to him, you had said you started with 9 holes. How long did it take before you got back to 18? Did you get there?
Yeah, no, I eventually did. It took a little while, I think mentally too, to tell myself that I could play a full 18 because nobody wants to pay for 18 and only pay 9. So I I did take it slow. I started with 9. I was playing 9 kind of consistently, and then you play 9, 10, 11. I'd go to the driving range afterwards, and I could still swing the club, and I felt great. So I started doing 18, and I've been doing 18. For a while now, for at least a year, I've been doing 18 every Wednesday, just about, or trying to.
Did you think it was going to be possible to get back to golf in this way? Or were you even wondering, or was there so much on your brain with the pain, like that wasn't even a thought?
No, I didn't know I was gonna come back to 100%, but I actually improved my golf game with the surgery because I can't overswing now. So it actually helped me increase my score or lower my score, increase my productivity in golf, I guess.
Okay, I have to say, Dr. Haynes is pretty impressed by this part of things. So yeah, I want to play another clip because this is a conversation. This was part of that conversation where you talked about what physically changed in your swing, and he was really interested in this. Let's play that part.
So the rotation, I would say, actually improved.
Yeah.
Physically, I feel like it's less, but I think it's actually improved because I can actually turn and come through now. Versus mentally, I feel like I'm turning, but I'm not. It probably stops here. Now I can get all the way around without any pain, movement. It's great.
One thing, a lot of times with disc replacement, like when you have disc deterioration over time, things just get tight, and even though you don't really notice it, things start to get tight. So having disc replacement, probably blessing in disguise in the sense of a lot of those other spots, things have broken down over time, and that herniation happened.
Yeah.
Having that trigger and loosening things up can help with some of the other rotation. Like a lot of times people get pain back in this area when it comes to cervical disc herniation.
I think I dealt with it so long that I didn't know where the pain was. So it was just I'd swing how it didn't hurt. So once it was fixed, it just opened me up to swing easier. I could actually get more movement. That's why I don't swing as hard.
Okay, so you described there, like, not only did you get back to golf, your game's improved.
It did. It's incredible. I guess the changing the swing to the injury and then getting back to where I can actually have the movement of my neck and being able to move my arms. It helped my range of motion. It helped me feel like I can't swing as hard as well, which is a huge part of the golf swing. Is you don't have to swing hard, you swing easier. So taking all of that and slowly rebuilding with the full motion actually increased my driver's distance, my overall score. It's huge. I went from shooting mid 80s to shooting low 80s, high 70s. So
wow. Is it, and are you having fun?
well, it's always fun, and golf's always fun and never fun at the same time. But yeah, I enjoy it.
It's amazing. Okay, you alluded to the mindset piece of it. What would you tell other golfers with back pain? Because and actually, before you do this, I want to play one more clip because this is where you and Dr. Haines were talking about the fear that your wife had before the surgery. So let's listen to that, and then we'll pick it up on the other side.
I think she was having the surgery first. If you would have seen us when you walked into the hospital, you would have thought she was having the surgery done. She was more nervous than me. I was like, all right, let's do this. And she was like, hold on, wait, don't we need to talk about this? We should do this. I'm like, oh, let's just go get it done. She's like, you're not worried? I'm like, no. I'm like, let's just go. I don't think he's going to cut my head off. I'll be fine. She's like, you can be paralyzed. I'm like, I could, but I'm not going to be. To me, I was already paralyzed. I was stuck in a movement of this. So to me, I already felt paralyzed.
The risk for you and for a lot of people, the risk of not doing surgery is so much higher than the small risk of surgery. Right? Not 100%. There are always some potential risk, but they're really, really, really uncommon, especially with disc replacement. 99% of the time it works out beautifully, just like with you.
It definitely worked out 100% for me.
Yeah.
So.
I love it. Makes my job fun.
That fear you talk about, is so common, certainly for the person undergoing the procedure, also for everyone who loves them. Can you talk about that fear? What do you want people to know about it? And I know your wife had more of it than you do, but for those who have it, what are your words of wisdom now that you're on the other side?
Yeah, I mean, this is a tough one because I mean, it is a fear, and I guess everybody does have, and they're always going to have a fear of getting a surgery done, especially something as major as this. There was a lot of concern of, you miss a nerve, you paralyze yourself, or it doesn't help, you have to go for another surgery. Um, but I think once you can think about where you're going to go and the improvement of what a surgery can do, I mean, I think that's where you have to put your mindset and not think about the negatives, but think about the positives that come out of it. Um, and like you said, my wife obviously pushed me to it a lot too because I'm stubborn and I would have kept dealing with it. But you have to have a support team, which is great that my wife did push me to it. She's a major support player in it, and spouses, kids, getting back to all of that is huge. I mean, not just golf, but I play with my kids now, and I can pick them up and throw them around, and they can jump on me and tackle me, and I'm not constantly rolling my arm or telling them no. It's I'm back to 100% to where I used to be.
Amazing. Amazing. Um, your story is fantastic. It's the perfect story for National Golf Month here. So here's my last question to you, just kind of a fun one, but do you have a golf goal? You want to go play somewhere? Did you reward yourself with a new set of clubs? I don't know. Has anything come along?
Well, I got a new set after my surgery. I couldn't swing the clubs that I had, so I did get a new set, which was, I have to thank the surgery for that as well because I got new clubs out of the deal.
Why
But
couldn't
no,
you
I mean,
swing the old ones?
what's that?
Why couldn't you swing the old ones?
They were too heavy. They
Sure,
were custom
likely
before
story.
surgery. They just, yeah, couldn't swing them as hard.
So, okay, so
Um,
lighter clubs have helped.
well, I think mentally it helped. All golf equipment's mental, anyways. I think.
Yep. Wow.
So, no, I mean, I guess the main goal is just to stay consistent and keep playing, and don't hold anything back. And I try not to think about the surgery or the kind of the outcomes anymore. It's kind of just go until my body tells me not to, and kind of knowing what you can do. And obviously, if it's something too dumb, not to do it. But for the most part, just going head first into everything. And I think that's kind of the change the outcome of everything is I haven't held it back. It's keep moving forwards.
Okay, and one more quick little thing, because I know Dr. Haines talks about, little things that you can do that make a difference. And I've seen him before. He says, like, one of the things you can do that's really bad for your back, and you see golfers do it all the time. When you're pulling the ball out of the hole, they lean over. You know what that move I'm talking about? Where
Yeah, everybody does it.
everyone does it, where like one foot goes out, they lean over with a straight back, they balance on, like, it's crazy and it's terrible for your back. Do you do anything different now, like bend at the knees to get the ball, or I don't know, are there any little tricks that you would pass on here that you do differently now that you're trying to take care of things of your back?
So I do bend over, but I use my knees more now. But I think that's just because I'm older now.
For sure. None of us are supposed to be doing that weird, like, straight back.
Exactly.
After like
No,
the age of 24, nobody should do that. Yeah,
no,
nobody.
but I do catch myself bending my knees a little bit more now instead of doing the straight bend over. I
Wow.
don't know if that's from the surgery or what I heard, but I'll leave it at that one.
All right, that we're gonna stop it there. I know that's Dr. Haynes' tip. Like bend at the knees when you recover,
There you go.
when you pick it up. That's important. So, Cade, so great to talk with you. Wishing you continued success and keep having fun on the golf course.
I appreciate it. Thank you.
Thank you.